From the JAMA Network, this is the JAMA Medical News Podcast, discussing timely topics in clinical medicine, biomedical sciences, public health, and health policy, featured in the medical news section of JAMA.
Welcome to this news roundup. I'm Kate Schweitzer, Associate Managing Editor of JAMA Medical News. On today's episode, we're talking about 3 stories we published in the past weeks. The first is on lawsuits filed by the Department of Justice against 2 of the nation's largest pharmacies for their alleged role in exacerbating the opioid crisis. Then we'll discuss the current measles outbreak in Texas and New Mexico and its connection with increasing vaccine hesitancy in the U.S. Finally, we'll dig into how, amid decreasing infant mortality, sleep-related infant deaths are on the rise. Freelance journalist Dr. Eli Kahan is joining me today. Hi, Eli.
Hey, Kate. Thanks for having me.
Of course. Let's jump right into your piece. The DOJ is suing Walgreens and CVS for their role in dispensing massive quantities of drugs that potentially aided and abetted the opioid epidemic. Can you walk us through what you discovered?
Sure. So this is pretty remarkable, and it was not something that I have to say was on my radar. So in the span of 30 days between this past December and January 2025, the U.S. Department of Justice sued both CVS and Walgreens, along with dozens of their state subsidiaries. The country's largest pharmacy chains, which collectively operate more than 17,000 storefronts, aided and abetted the opiate epidemic, the federal lawsuits allege. The civil lawsuits rest on the allegation that the pharmacy chains violated both the Controlled Substance Act and the False Claims Act. The first of those, the Controlled Substances Act, states that narcotics can only be used for, quote, a useful and legitimate medical purpose. By filling prescriptions that were evidently invalid and illegitimate, the pharmacies, quote, made choices that caused these millions of violations of federal law, the DOJ alleged in the Walgreens lawsuit. And the False Claims Act, for its part, states that entities cannot, quote, knowingly present a false or fraudulent claim for government payment, either due to, quote, deliberate ignorance or, quote, reckless disregard of the claim's falsehood. In the pharmacy's case, the DOJ alleged by requesting reimbursement from Medicare and Medicaid for illegitimate prescriptions, the pharmacies broke the law. They presented fraudulent checks that they requested payment for. In summary, the pharmacies unlawfully dispensed, quote, massive quantities of opiates and other controlled substances to fuel their own profits at the expense of public health and safety, the lawsuit against CVS says. And the government cited tons of evidence, over 800 pages between the 2 lawsuits. And one of the key pieces of evidence was repeatedly greenlighting prescriptions of what substance abuse researchers call the Holy Trinity, an opiate, a benzodiazepine, and a muscle relaxant, the 3 of which potentiate a certain kind of high, but also are really dangerous and lead to overdoses at extremely high rates. And the higher-ups at Walgreens and CVS knew full well how addictive and dangerous this triplet prescription was, but they kept on letting pharmacists fill the prescriptions anyway, the DOJ says.
But why target pharmacies? Isn't it more important to target distributors and manufacturers? After all, they seem to be the heavy hitters when it comes to fueling the opioid epidemic.
Yeah, and Kate, I think manufacturers and distributors are the people we think about when we think about the really bad actors in the opiate epidemic. I mean, there's been tons of ink spilled writing about Purdue Pharma. There has been less, but a significant amount of legal activity around distributors like McKesson. But people call pharmacies and pharmacists the final gatekeepers of prescriptions. So you could have manufacturers like Purdue selling and marketing the stuff to doctors, distributors like McKesson getting it over there, pill mill docs writing the scripts. But if the pharmacists don't sign off, it's all for naught. And distributors like Purdue knew this full well, by the way. Research and reporting on internal documents describe that the company explicitly targeted pharmacists. So by going after the pharmacists, the DOJ are really saying, you guys played a role here, and in part, perhaps saying a lot of this might not have happened without pharmacists playing a role.
And Eli, why does it matter that the DOJ is suing pharmacies? Several states have already done this. What do the experts you spoke with predict will change?
Yeah, it's a bit wonky, so bear with me, but I think a lot of this comes down to matters of jurisdiction. And at the end of the day, what these settlements, the opportunity here is both to provide better knowledge of pharmacies' role in crisis, as well as better action to stop this from happening in the future. The problem with the state suits is that individual states have enough jurisdiction that they can gather information in the process of discovery that relates to their state, and they can file injunctions to prevent further action really only in their state. But we know, based on all the documents the DOJ presented and research elsewhere and reporting elsewhere, that CVS and Walgreens, the ways in which they were managing the opiate epidemic and perhaps aiding and abetting the opiate epidemic, these were systemic protocols that were happening at the national scale. And so the states just simply don't have access to the documents, and they simply don't have access to the legal means to file injunctions in a way that would sustainably present and prevent, I should say, this from happening in the future. The hope with the DOJ suit is that the DOJ can sort of gather more documents and more evidence than the states did individually, and that evidence can form the basis for further lawsuits potentially in the future, as well as really enacting federal actions or large-scale actions that can both stop the pharmacies from doing this in the future, and researchers hope that they can take action that is not only reactive but is proactive. They can use perhaps some of the proceeds of these suits to take national actions that can support harm reduction, say, or other means of reducing the toll of the opioid crisis. This has been a major point of contention at the state level. There's lots of concern that even the funds that states have fought really hard to get aren't being used efficiently or effectively, and the hope is maybe at the federal level, these funds may be put to better use.
Got it. Thank you, Eli. Next up, the measles outbreak. Back in 2000, the U.S. declared that measles had been eradicated. But in recent years, the highly contagious yet preventable disease has returned, and there's now an outbreak in Texas and New Mexico. So far this year, more than 375 measles cases have been reported across 18 states. At least those are the latest stats at the time of this recording. And they've resulted in 2 deaths, the first measles deaths in the U.S. in a decade. According to the experts I spoke with, this outbreak is just the tip of the spear of a dangerous national trend of increasing vaccine hesitancy, namely unprecedented divisiveness around public health, which has led state and federal actions to weaken vaccination policy. And the data confirms this shift. After years of steady vaccine uptake, we've seen a significant decline in vaccination rates, particularly since the COVID-19 pandemic. The proportion of kindergartners with complete MMR, that's measles, mumps, rubella vaccine, the records have fallen from about 95%, which is the federal coverage target, to less than 93% last school year. And in recent weeks, concerns over the far-reaching effects of vaccine hesitancy have soared. For starters, there's the conflicted response from newly appointed U.S. Secretary of Health and Human Services, Robert F. Kennedy Jr., who's known for his longstanding opposition to vaccines. He promised senators he wouldn't dismantle the nation's vaccine safety systems during his confirmation hearing, and then vowed to investigate the U.S. immunization schedule after taking office. He penned an editorial that highlighted the measles vaccine but stopped short of urging its use, citing personal choice. Meanwhile, he's promoted unproven treatments like cod liver oil. The CDC is also now recommending vitamin A as part of supportive management for measles. But neither of these are alternatives to vaccination, which clinicians fear is not being made clear.
Kate, I know that this hasn't been an issue that has been for want of news lately. I know the Trump administration has made other moves that hinder vaccine policy beyond measles. What are those?
Right. In the span of a week, 2 key vaccine-related meetings were pulled off calendars. First, there was a meeting for a group of CDC vaccine advisors known as the Advisory Committee on Immunization Practices. They plan to vote on the use of some recently approved vaccines and on new recommendations for flu and RSV vaccinations, but it was postponed indefinitely. Then there was the cancellation of a key FDA meeting where the composition of this coming year's flu vaccine was to be discussed. Reports also surfaced that the CDC was ordered to stop running certain vaccine ads because Kennedy wanted to emphasize, quote, informed consent, which is the principle that a patient should be notified of all possible risks of a medical intervention, not just the benefits. But this is already commonplace in clinical practice. And clinicians worry that highlighting them may further cause patients to believe that vaccines pose greater harm than the diseases they prevent. And equal alarming, I found, was how all of this has come atop what one of my sources called the hangover effect of COVID and the many unintended consequences of vaccine mandates that took place at that time. Immunization has had bipartisan support for decades, but now there's a well-funded anti-vaccine ecosystem at work, a growing wariness around governmental overreach, and an uptick in individuals turning to social media or wellness influencers for guidance they'd once gotten from their doctors. And the administration seems to be fanning those flames. Federal officials recently announced plans to conduct a study re-examining the long-debunked connection between the MMR vaccine and autism. And there are very real consequences to all of this. More than 3% of U.S. kindergartners now have non-medical exemptions from at least one required vaccine, which represents more than 93% of all reported exemptions. In the epicenter of Texas's measles outbreak, Gaines County, there is a nearly 18% exemption rate. And if vaccine hesitancy continues to rise, coupled with this lack of updated research or guidelines, then outbreaks won't end with measles. Because measles is so contagious, it's a bellwether of sorts, a warning sign of what's to come with declining vaccination rates. If they continue to drop, one expert said, the U.S. may need to prepare for a return of diseases such as diphtheria or even polio.
Well, that's a little bleak, I have to say. I mean, obviously, it's a challenging time for a lot of things in health. What's the silver lining? What are the reasons for optimism here? What can be done to instill confidence in vaccines again?
Sure. And luckily, the experts I interviewed did have several recommendations. Most crucial is the need to counter misinformation and, frankly, to do it faster, ideally in real time. Public health agencies are notoriously slow and they've historically ignored false claims so as not to amplify them. But my experts agree the goal should be to flood bad information with good information 24/7. And to that end, scientific information needs to be presented in accessible formats using storytelling and visual aids. It may sound simple, but even well-crafted infographics that compare the risk of a vaccine to the far outweighed risk of the illness itself could help a lot in making that information more clear to the masses. And advocacy at the state level is another need. So far this year, vaccine-related bills are being pushed forward in more than 15 states, with religious exemptions among the most popular. But perhaps the hardest hurdle to surmount is how vaccination may be the ultimate victim of its own success. It's worth noting that federal programs like Vaccines for Children, which purchases and distributes inoculations, and the National Vaccine Injury Compensation Program, those often fade into the background precisely because they work so well. And the same goes for the vaccines themselves. They've been so effective for so long that people don't actually know about measles or whooping cough or polio. As one source said, when these diseases were raging, people lined up to get their shots. Parents signed their children up for studies readily. Of course, the answer can't be that we let everyone get polio again to help people value the polio vaccine. It really comes down to depoliticizing vaccines. They target everyone, no matter which side of the line they're on. And the end goal is to move this from a political debate to a discussion focused on health. Okay, and other news affecting children's health. Next, we'll talk about the increase in sudden unexpected infant deaths, a category that includes sudden infant death syndrome, or SIDS. Freelance writer Linda Rogers wrote this story for us, and Eli is going to tell us about it. Eli, as a practicing pediatrician yourself, what stands out to you most that clinicians need to know about this?
Yeah, this study resonates with me deeply. I'm finishing my pediatric residency, but I'm going into neonatology. And often, in the NICU, one of the first things we see when we walk into a patient's room is how the baby's sleeping. Too often, unfortunately, it's out of keeping with AAP recommendations. And that partially is because we have tools like continuous pulse oximetry that allows us to monitor the baby in ways that parents can at home. But we NICU docs, I think, often pride ourselves on not only noticing when it's unsafe, but also taking time to coach families up on safe sleep. But the new research that came out and that Linda covered shows we could be doing so much better. SUID rates declined in the 1990s, plateaued in the first 2 decades of the 2000s, and then they're increasing between 2020 and 2022. And the SUID mortality rate also increased during those years. I think it's worth pointing out those risks aren't evenly distributed. Between 2018 and 2022, the SUID rate was much higher in American Indian and Alaska Native, Black, Native, Hawaiian, and other Pacific Islander infants than Asian infants, Hispanic infants, and white infants. I think it's also worth noting this isn't the only study finding concerns with sleep habits. There was a recent study in JAMA Network Open that showed that 12% of 4-month-old babies in the US are still put to sleep lying on their sides or tummies, which of course is also out of keeping with AAP recommendations and really risks SUID. So I think overall it's worrisome. The really important points that the researchers describe here is not only that parents didn't get the information that they needed, which I think falls into this realm of research and quality improvement that we've thought about as some combination of improving medical education, as well as understanding health literacy, understanding that parents aren't assimilating the information that they're getting and making sure that we have toolkits and other things that provide all the other information that they need. But I think the other piece of this is that, as the authors note, quote, the pandemic led to a terrible erosion of trust in public health. And a big part of safe sleep is public health messaging, as well as messaging at the individual level. And I love that Michael Goodstein, who's the director of newborn medicine at WellSpan Health in York, Pennsylvania, and a member of the American Academy of Pediatrics Committee on SUID, describe this, because I think there's a lot we can do to improve the way in which we are communicating to patients, not just the way they're receiving the information that we give, but how we're formulating the information and how we're delivering it. And I think we can do so much better in terms of building trust with these families in big ways and small, and showing up every single day and trying to have one conversation that's meaningful and restores some of the trust that perhaps people lost during the pandemic in their doctors.
Why did rates of these unexpected infant deaths go up during the pandemic? Why are they continuing to go up? One might assume they would at least plateau after lockdowns lifted. Can you kind of talk us through that?
Yeah, I think there are a couple theories about this, Kate. I think one theory says, well, a lot of people were not going to their routine doctor's visits. And so just as a matter of volume and face time, we doctors did not have the opportunity to provide information to patients. Patients were not exposed to that information. I think that's one theory that is just looking at the healthcare utilization rates during the pandemic and saying, well, this is why it went down. I think that theory doesn't really explain, however, the persistence of these trends unless you think there's a little bit of latency time and people are not catching up with their doctors soon enough to make a difference in safe sleep. But I think the safe sleep conversation is one that you can have in a single visit. And so the idea that these patterns would persist if it was solely lack of patients getting in to see their pediatricians in clinic, I'm not sure if that explains all of it.
Right. Another factor, which seems to be a thread through a few of our stories today, is the influence of social media on public health. Just scroll through the hashtag sleeping baby on Instagram, and among the 1.4 million posts, you'll find countless images of babies sleeping in positions and places that go against the safe sleep guidelines of the American Academy of Pediatrics. Cribs filled with fuzzy blankets and stuffed animals, or infants napping on their stomachs. As one source in the story noted, parents tend to follow the social norms of their communities. And the internet, for better or worse, certainly qualifies as one such community. All right. Thank you, Eli. Additional factors that potentially affect sudden unexpected infant deaths can also be found in the JAMA Pediatrics study for which this article was based. And if you'd like to learn more on any of the topics we discussed today, we'll include links to those stories in this episode's description. This month, we also reported on new recommendations from the American College of Cardiology and the American Heart Association for managing patients after they've experienced a heart attack. And check out our new data brief on the public's trust in artificial intelligence and its ability to provide accurate health information. And finally, our interview series on AI and clinical practice continues. You can listen to these episodes in this show's feed at JAMA Network's YouTube channel or at JAMA.com. Or better yet, follow the new JAMA Network podcast, JAMA Plus AI Conversations. That's it for this JAMA Medical News Summary. I'm Kate Schweitzer. Thanks again to Eli Kahan. This episode was produced by Daniel Musisi at the JAMA Network. To follow this and other JAMA Network podcasts, please visit us online at jamanetworkaudio.com. Thanks for listening, and join us again next time.
This content is protected by copyright by the American Medical Association with all rights reserved, including those for text and data mining, AI training, and similar technologies.